Pop quiz. A 29-year-old pregnant woman at 30 weeks gestation is admitted with preterm labor. The provider orders a tocolytic agent to delay delivery. Which of the following medications is most appropriate and what is the primary purpose of its use? A. Oxytocin to enhance uterine contractions. B. Terbutaline to relax the uterus and delay labor. C. Magnesium sulfate to reduce maternal blood pressure. Or D. Misoprostol to ripen the cervix. And guys, the correct answer is going to be, what is it going to be? B, terbutaline to relax the uterus and delay labor. So in the question, they tell us that she's only 30 weeks. They didn't even have to tell us that we want to delay labor, but they were nice. They told us that we're giving a tocolytic agent. That was our second clue. And our third clue is that we want to delay labor. It's going to be terbutaline. It's going to relax the uterus, and it's going to buy us time. Why are we trying to buy time? Well, the fetus is going to get what? Betamethasone. They're going to get a corticosteroid to help promote lung maturity. Okay? Now, let's look at the wrong answer choices. A, oxytocin to enhance uterine contraction. Well, oxytocin does enhance uterine contraction, but why would we give that if we're trying to delay labor and delivery, right? That makes no sense. C, magnesium sulfate to reduce maternal blood pressure. I cannot tell you how many nursing students get this type of question wrong on exam. Let me make this clear to you. Yes, magnesium sulfate does lower the blood pressure, but never, ever, 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 ever are we going to give it to lower the blood pressure. We're going to give it to relax those muscles. Mom is in preeclampsia. We don't want to go to eclampsia. We want to relax those muscles. She's going to get magnesium sulfate for that purpose, but not to lower the blood pressure, although that's a side effect. It's a welcome side effect. Yes, we want the blood pressure to go down. Here's a problem. Magnesium sulfate has a very narrow therapeutic range, and the adverse effects are horrendous. There are so many wonderful drugs on the market that will lower the blood pressure without those adverse effects. We will never give it to lower the blood pressure. Yes, that's a side effect. We welcome it, but we're never going to give it specifically to lower the blood pressure. There are better drugs on the market for it. Please believe me when I say this to you guys. If you see this question, don't fall for it. It's a trick question. All right, last. Misoprostol to ripen the cervix. Yes, it does ripen the cervix. It is a prostaglandin analog, but again, we're trying to delay labor and delivery. So the correct answer would be terbutaline. By the way, guys, for testing purposes, you see all four of these drugs, you have to know them, you have to know the indications, and you have to know the adverse effects and the nursing interventions for each of these medications.